Okay, good afternoon. Senator Abrams, Senator Lesser, oh, he's not here, Representative Steinberg, and other members of the Public Health Committee. And I want to say a special thank you to Senator Summers for introducing this bill. 380. Okay. That's okay. Yes. I'm Louise Pyers, Executive Director of the Connecticut Alliance to Benefit Law Enforcement. It's a coalition of police professionals, licensed mental health providers, and other stakeholders dedicated to the mental health and well-being of those in law enforcement and the communities they serve through training, mental health training, support, and advocacy. I'm writing to you in support of proposed bill number 380, an act concerning mental health and wellness training and suicide prevention for law enforcement officers. Police officers work in very toxic environments on a daily basis. They're exposed to traumatic events that most of us cannot even imagine. They see things that no one should see. Yet they continue to go to work every day in service to their communities. It can take its toll. As the brain tries to protect itself from the onslaught of the cumulative stress officers face and trauma, it can cause changes in behavior that can lead to relationship problems, addictions, and even suicide. If a police officer currently, under current law, statute, seeks help for suicidal thinking that may require an inpatient stay in a hospital, he or she can face serious ramifications up to and including one's job and livelihood due a change in the statute that became effective in 2003. In essence, anyone who voluntarily admits himself or herself to an inpatient stay in a psychiatric hospital will lose the capacity to carry a weapon for 6 months. For a police officer, this means they are unable to carry out the duties of their profession without a weapon to protect oneself and others. An officer risks losing his or her livelihood. No other segment of the population faces job loss because they have to wait 6 months to carry a weapon after an inpatient psychiatric stay. Many officers will not seek help under these circumstances. The current statute does nothing to encourage our officers to seek help. In fact, it's a deterrent. Prior to this change in statute, officers were given a fitness for duty exam administered by a specially trained psychiatrist so that they could safely return to work if that exam was found positive. I hope we can go back to that option so officers can seek help without fear. Thank you.
Other questions? Senator Summers.
Good afternoon, and thank you for your testimony. I too think that this is a very important issue that the Public Health Committee should take up. We in the Public Health have talked about how important mental health is, how we want to work on the stigma associated with mental health, and this is a perfect example that our law enforcement men and women are put in a situation that really no other profession is pushed in, and that they experience on a daily, if not hourly basis, a sense of heightened alert.
Yes.
They never know what they're going to walk into, what the situation is, what it will turn, and quite frankly, they don't know if they're going to return to their families at the end of the day. That is very different than any of us up here or probably out in the audience have to experience on a daily basis. And you can imagine what kind of toll that can take on your mental health and well-being. It's my understanding right now, to circumvent the law that we have, many of our officers received help sort of on the down low outside of the state,
Yes.
which is not helping. It's not the way we should be. Mental health should be out in the front. It shouldn't be stigmatized, and it should be something that we all have an ability to have access to without the fear of losing our job. That being said, you can see, quite frankly, some of the studies have shown when we're not providing that type of mental health relief for those who need it, depending on what we see for trauma, et cetera, that leads to a massive increase in divorce rates. It leads to, obviously, suicide rates of the folks that in an industry or a profession that it is difficult at this point to get anyone to want to become a police officer with all the scrutiny, et cetera, that goes along with it in this day and age. And in Illinois last year, they did pass, actually 2 years ago, they passed a law which is very similar to what we're looking to do here, which simply states, I'm just going to read it really quickly, that no law enforcement officer employed by a unit of government shall have his firearm revoked for an extended period of time or his job denied because a patient or the officer has visited a mental health facility within the last 5 years, unless, and this is the caveat, the department receives an affirmative in-writing statement by a treating clinical psychiatrist or psychologist or physician that the officer is a threat to himself or to others. And I think that's something that we should look to go back to so we can encourage those who are on the first line of defense for all of us here that protect us every day, have access to the care that they need without fear of losing their jobs. Thank you.
Thank you.
Thank you, Senator. Representative Clarice Dietrich?